A surgeon's rise. The early years of Dr. Jonathan Hargrove. The name resonated within the hallowed halls of St. Mary's Hospital. It was a name that carried weight, a name that promised hope and healing. He was a rising star, a brilliant cardiothoracic surgeon. His hands worked miracles, and his mind was a repository of medical knowledge. His talent was undeniable. Patients lauded his skill, and colleagues admired his precision. He was the doctor everyone wanted on their case, the surgeon everyone trusted with their lives. Dr. Hargrove exuded an aura of quiet confidence. He inspired trust and offered hope. His demeanor was calm, his presence reassuring. From the early 1990s, his career flourished. He was a beacon of medical brilliance, holding a position of power and respect at St. Mary's. His reputation grew, and with it, the expectations of those around him. His future seemed limitless. The medical community saw him as a prodigy, a man destined for greatness. He was dedicated to his craft, spending long hours in the operating room and poring over medical journals. Dr. Hargrove dedicated himself to his craft, spending long hours in the operating room and poring over medical journals. He was relentless in his pursuit of perfection, always striving to be better, to do more. His dedication was absolute. His patients were his priority, or so everyone believed. He was seen as a hero, a savior in a white coat. Behind the charming facade, a darkness festered. A hidden obsession with death lurked beneath the surface, waiting for the opportune moment to emerge. It was a side of him that no one saw, a side that he kept well hidden. Dr. Hargrove's success was built on a foundation of lives saved, but this foundation would soon crumble. The cracks were there if one looked closely enough, but they were easy to miss amidst the accolades and praise. It would give way to a terrifying truth, a truth that would shatter the illusion of the perfect doctor, the infallible surgeon. Dr. Hargrove was not who he appeared to be. The man who was seen as a savior was, in reality, something far more sinister. He was not a savior. He was a destroyer, a monster hiding in plain sight. His actions, once uncovered, would reveal a mind twisted by dark desires. His story serves as a chilling reminder. Evil can wear many masks. It can present itself as kindness, as competence, as trustworthiness. It can hide behind charming smiles and gentle touches. It can be the hand that heals and the hand that harms. It can deceive even the most discerning eye. The facade can be so perfect, so convincing, that the truth remains hidden until it is too late. This is the story of Dr. Jonathan Hargrove, a story of brilliance and darkness, of healing and harm. This is the story of the Scalpel Slayer, a tale that serves as a stark reminder of the duality of human nature. Whispers in the corridors. Unusual complications and growing concerns. The year was 1995. A subtle shift occurred at St. Mary's. The hospital, known for its impeccable reputation and dedicated staff, began to experience a series of unsettling events that would soon become the talk of the town. Whispers began to circulate. Nurses, ever vigilant, noticed an anomaly. It started with a few isolated incidents, but soon, the frequency of these occurrences became too significant to ignore. Patients under Dr. Hargrove's care were experiencing unusual complications. These were not the typical post-operative issues, but rather unexpected and severe setbacks that puzzled the medical staff. Post-operative recoveries were fraught with unexpected setbacks. Patients who were expected to recover smoothly found themselves battling unforeseen complications, leading to prolonged hospital stays and increased anxiety among their families. Some patients, inexplicably, took a turn for the worse. Despite the best efforts of the medical team, their conditions deteriorated rapidly, leaving doctors and nurses scrambling to provide the necessary care. At first, these incidents were dismissed as unfortunate, yet statistically possible occurrences. The medical field is fraught with uncertainties, and not every patient responds to treatment in the same way. After all, surgery carried inherent risks. Not every patient responded to treatment as expected. Complications, though rare, were not unheard of, and the staff tried to maintain a sense of normalcy. But the whispers persisted. They grew louder, fueled by unease. The staff began to connect the dots, realizing that these were not isolated incidents but part of a troubling pattern. Experienced nurses, accustomed to the rhythms of the surgical ward, felt a disquiet. Their instincts told them that something was amiss, and they couldn't shake off the feeling of impending doom. Something wasn't right. The frequency of complications seemed abnormally high. The staff's growing concern turned into a collective anxiety that permeated the hospital corridors. The nature of these complications seemed unusual. Still, concrete evidence remained elusive. The staff needed more than just their gut feelings to confront the issue head-on. Dr. Hargrove, with his impeccable credentials and calm demeanor, remained above suspicion. His reputation as a skilled surgeon made it difficult for anyone to believe he could be at the center of these complications. Fear and uncertainty cast long shadows in the corridors of St. Mary's. The staff found themselves in a dilemma, torn between their professional duty and the growing suspicion that something was terribly wrong. The staff grappled with their concerns. Speaking out against a surgeon of Dr. Hargrove's stature carried significant risk. They feared retribution and the potential damage to their careers. The hospital administration, reluctant to believe such accusations, initially hesitated. They needed more than whispers and suspicions to take any action against a respected member of their team. They needed more than whispers and suspicions. They needed proof. The staff knew that without concrete evidence, their concerns would be dismissed, and the unsettling pattern would continue unchecked. The Bennett case, a death that shattered the facade, 1996. The case of Sarah Bennett shook St. Mary's Hospital to its core. Sarah, a vibrant young woman, was admitted for a routine heart valve replacement. Dr. Hargrove, the best in his field, was the obvious choice for her surgery. The procedure, by all accounts, was a success. Relief washed over Sarah's family. Their daughter was going to be fine. But their relief was short-lived. Sarah's condition deteriorated rapidly. She died within 48 hours, her death deemed a tragic anomaly. Except it wasn't an isolated incident. Sarah's death, however, was different. It ignited a firestorm of suspicion. The whispers escalated into hushed conversations. Sarah's family, devastated and suspicious, demanded answers. Her death, they argued, was not a natural consequence of surgery. Their insistence prompted a closer look at Dr. Hargrove's recent cases. The hospital, now facing mounting pressure, launched an internal inquiry. Unveiling a pattern. When statistics spoke louder than words. From 1997 to 1998, the truth became horrifyingly clear. The hospital, once a beacon of hope and healing, was now shrouded in a dark mystery. Patients who should have recovered were dying at an alarming rate, and the numbers were too stark to ignore. A chilling pattern emerged from the data. The mortality rates were not just high, they were unprecedented. Each data point was a life lost, a family shattered. Dr. Hargrove's mortality rate was statistically improbable. It defied all logical explanations and raised immediate red flags among the analysts. It was significantly higher than the national average. The numbers didn't lie. Something sinister was afoot. The hospital staff, who had once revered Dr. Hargrove, began to whisper in hushed tones, their trust eroding with each passing day. The hospital administration, finally forced to confront the grim reality, could no longer ignore the mounting evidence. Meetings grew tense, and the air was thick with anxiety. Their internal inquiry took on a new urgency. Every piece of data, every patient file, every anomaly was scrutinized with a fine-tooth comb. Every death, every complication, every unusual symptom was scrutinized. The team worked tirelessly, often late into the night, driven by a need to uncover the truth. The investigation, however, faced a significant obstacle. Despite their best efforts, they kept running into dead ends. Dr. Hargrove, a brilliant surgeon, had covered his tracks meticulously. His records were flawless, his procedures impeccable. There were no obvious signs of malpractice. Everything appeared to be in perfect order, making it nearly impossible to pinpoint any wrongdoing. No glaring errors in judgment. The team was left perplexed, their frustration mounting as they hit one roadblock after another. The investigation seemed to hit a wall. The more they dug, the more elusive the truth became. The hospital administration, torn between protecting its reputation and uncovering the truth, found themselves at a crossroads. They needed help. The stakes were too high to ignore. They needed someone with the expertise to unravel this complex and disturbing puzzle. They needed an outsider. An expert who could see what they couldn't, who could connect the dots and bring clarity to the chaos.